converting an intuition. So whenever I talk to politicians about this, generally politicians who describe themselves as sensible and mainstream, they say, well, look, this is sort of a nice idea, but it's just fantasy, and nobody would vote for a policy like UBI. And what we've done is just to turn that on its head. And the question I ask now is, why don't we have UBI? Because UBI, in so many different ways, does what we need public policy to do. It satisfies our needs. It secures us against destitution. What could be more important than avoiding starvation, destitution? This is vitally important. And it lets us do things we need to do. It enables us to train, to educate ourselves, to care, to look after our families, to engage in entrepreneurship, particularly in those areas of the country which have been left behind by radical inequalities and growth. It helps us individually. It enables us to secure ourselves as individuals and thereby to contribute to our communities, our nation, and to improve a whole range of different outcomes that are critical to our futures going forward. Most frighteningly, rich people have already got basic income. So as somebody who grew up on benefits, an archetypal benefits-based family in the northeast of England, one of the most shocking things that came to me when I went to university at Newcastle for the first time was that I've been encountering people who had basic income. The parents would be giving them tens of thousands of pounds to spend on whatever they liked throughout their studies. There was no cost of failure because their parents would just find them more resources irrespective of the sort of outcomes they produced through university. And one of the things that we have in society, we have people raising this objection about UBI, saying, well, it'll render people lazy, it'll render people inactive, and yet all of the evidence that we have about the resources that people have access to is that the sort of figures that we're talking about, and even if you times those figures by 10, there's still no appreciable difference in terms of the kind of activity that people engage in. So the amount of activity that people engage in. But there is a difference in terms of quality and the kind of activity that people engage in. So what we've done in this report, and it's an interim report, so these are preliminary findings, but they speak to findings about which there is a good deal of confidence, is to dismantle the nice idea but nobody would vote for it claim. And that's vitally important at a time in which our politics is so pessimistic. Because time after time when I speak to sensible politicians, they say, well, look, we understand how to win elections. And you win elections by saying, we're slightly nicer than the other guys. Right? We're slightly more competent than the other guys. And the reality is that these people have been losing for 17 years. And in that time, our country has declined so significantly as to be almost unrecognizable. And there are a lot of people in this audience, without characterizing people's ages, who are older, right? Who lived in a time in which there was greater social security, a time in which there were much more progressive rates of taxation, in which the top rate of taxation was in the 80s and 90%. And what that kind of socioeconomic system produced was a greater degree of security and precisely the sort of outcomes that I'm going to be talking about today. Better outcomes, the sort of outcomes that we should be promoting as a society. So why are we so focused on the health impacts of UBI? Well, we produced this extremely convoluted and frankly impossible to read logic model for you today. But this stems from long-term collaboration about the prospective impact of UBI on health. And what we argue is that, look, there are three key pathways that UBI offers above alternative means and needs-based targeted welfare systems that ensures that it produces a much greater, much more successful impact in public health. Firstly, it reduces poverty. So as Natalie mentioned, there's scope to improve the access to basic good resources that the worst off in society have access to. It mitigates inequality. It enables us to leave demeaning, abusive, exploitative situations, whether in the household or at work. It enables us to escape from those sorts of experiences of domination that do such damage to us through exposure to long-term stress. And finally, it has a behavioral impact that goes beyond any comparable system, which is to say, by ensuring that people feel that their futures are secure, it brings back the shadow of the future. It enables people to think about their long-term interests, to invest in those behaviors that are likely to promote their longevity, and to reduce those behaviors which damage their long-term interests. So I had a few Scottish friends who used to talk about smoking as being their pension plan. It's a pension plan. You don't have to worry about pension if you smoke. You just divert all of your interests to smoking, hedonistic pleasures. And what you see in the evidence is that when people have got a low perceived longevity in life, they engage in hedonistic pleasures. There's no point thinking about the future. This kind of social security transforms it. It ensures that people invest in the future. So in lots of different ways, forgetting about all of the educational, employment, entrepreneurial, crime-based benefits that UBI might offer, this is the perfect multi-purpose policy for public health. Perfect, in lots of different respects. So people then say, oh, God, just UBI, that sounds unaffordable, absolutely impossible to implement in a society that's functioning economically. Definitely not in a society like our own, which is economically dysfunctional. The opposite is true. This is something that we can't afford not to have. We have to have it. And we have to have it because it's feasible. We've done land and tax transfer modelling on this. We could introduce a starter scheme now with no net increase in taxation, so you could still have the mildly progressive taxation system that we have at the minute, and introduce a UBI system that would bring people scraping towards a decent standard of living. The more costly schemes can be funded through any number of different means that don't touch income tax for the lowest earners. You can introduce wealth and land taxes. You can massively increase tax on those companies, those organisations that are frankly ruining our planet and offering us very little benefit as a nation. In lots of different ways, these companies are anti-patriotic. They're ruining our country. And we need, if we're concerned about the future of Britain, we need seriously to think about the way in which we claw back this power, this hold that they have on not just on the political system, but on our economy as a whole. But beyond that, beyond removing reliefs and subsidies, we've got so many savings in efficiency and health that this scheme can offer. We can reduce all of the administrative costs associated with the existing welfare system. And one of the interesting things that's emerged in the last few weeks with Rishi Sunak is that he accepts that argument. It's just really difficult to administer payments to members of society. So let's do away with all of that inefficiency. Let's get rid of the red tape that those sorts of politicians constantly harp on about. Let's get rid of it. Let's get rid of the DDPP and replace it with something that guarantees security from birth to death. But it also offers, as we'll see, huge savings in health. Now, we're just examining the impact of UBI schemes on anxiety and depression. The schemes that we're talking about would have impacts way beyond mental health to a range of physical conditions that absolutely hamper our ability to have a functioning public health system. So we think we can potentially save in the region of beyond £100 billion each year, just in terms of the sort of improvement in health that schemes like this would offer. So what's the evidence behind this? What's the evidence base to suggest that money affects health and that improving people's financial security would improve their health? Well, I draw your attention to these two sets of graphs. This is the health gradient in terms of anxiety and depression drawn from Understanding Society, which is a longitudinal household study. So you can see here, even just within our cohort, which is extremely complicated in a number of different ways, there's a clear gradient. And there are lots of different ways in which we control for other factors in terms of...
Could you tell us what is plotted against what? I can't read.
Yeah, it's not great. So these are income quintiles at the bottom, and these are rates of anxiety and depression. Yeah. So you've got there a health gradient which is clear. That's almost clear. Yeah. And on the right, you can see income plotted against perceived risk of destitution, top left, depression rates, PHQ scores against equalized annual income, all against equalized annual income. Anxiety scores on the bottom right, and yeah, I'm struggling to see that top one. What's that?
Satisfaction.
Satisfaction, yeah, satisfaction. So what this demonstrates is actually there's a key threshold. Once you get to 10 grand, rates of individual benefit unit income, once you get to 10 grand, actually levels of anxiety, levels of depression fall off a cliff. Satisfaction with income increases, and risk of destitution decreases. So risk of destitution, perceived risk of destitution, depression, anxiety, they're all closely correlated. There's good evidence there that there's an impact of people's financial security and their mental health. So there's something about getting to that threshold, and that threshold coincides with something like a minimum income, standard level of income, which is really important. So it suggests that if you get to a minimally decent amount of income, you get these big impacts. Go on in. Yeah. And this is borne out in the qualitative evidence that we've looked at. So we've worked with young people in areas of deprivation in Bradford, through HIC's existing in private and act early schemes. And young people are really thoughtful in the way in which they understand the world. They just apply that this is not a system that works. This is a system that actively stifles not just aspirations that people might think are fantastical. It stifles basic expectations that previous generations have taken for granted. These are people completely without hope, completely without expectation of a life in which work leads to family, leads to equity in housing. These are people who recognise a pretty desperate state of affairs. And that's borne out actually in the Understanding Society sample. 50% of young people have reached clinical threshold anxiety and depression scores. And that's gone up from what seems a historical anomaly in terms of recent history after the global financial crisis, in which people had 33% clinical threshold score for anxiety and depression. And you see with each electoral outcome, there's this big jump in of anxiety and depression. And from 2019 onwards, the election of 2019, pandemic, you get a big jump to 50%. So this is a national disgrace. 50% of our kids, our young people, are anxious and depressed to a clinical level. And they see this in terms of just their inability to do basic things in terms of education, in terms of achieving sort of security and family life that previous generations took for granted. And as a consequence of that, we've got two positions on social security. They're kind of incredulous that a system like EMA, international maintenance allowance, would ever have existed. It's just done away with a few years ago. You were funded to stay on in school. People had grants to go to university. This is bizarre. Ridiculous. Totally impossible. So against that sort of background, they thought, well, yeah, of course, everybody would benefit from something like the UK. So this is a generation in which there is great pessimism, but also great open-mindedness in terms of their positions on public policy. So what would be the impact on public health? Well, yeah. So this is our interim cluster of findings on the impact of 3 schemes, start scheme all the way up to minimum income standard scheme, and their impact on anxiety and depression. Scheme 1, starter scheme. Scheme 3, minimum income standard scheme. Just by introducing these schemes for this 16 to 24-year-old cohort, each year you would prevent or delay between 29,000 and 46,000 cases of anxiety and depression. And if just 50% of those cases are diagnosed by a clinician, you can save between 99 million and 60 million pounds, sufficient to fund hundreds, even thousands of mental health nurses. That is a huge, huge financial impact just on that one age group. Expand that out to the entire population, expand it out to all of these non-communicable diseases that hamper our public health system on a daily basis. You're talking about tens of billions of pounds. So this is a system that we cannot afford not to introduce. We need to introduce it. But people then say, oh, nice idea, but nobody would vote for this. And it's just not true. So if you were to believe people's, certainly the opposition's responses to the 2019 election results, you'd assume that people in red wall constituencies that I grew up in, constituencies that I still live in, are right-wing fanatics who want the most regressive taxation system, the most austere public finances, people who are entirely opposed to any kind of progressive change. It's nonsense. Just nonsense. The work that we've done in the Red Wall demonstrates that actually these are people who recognise that they're exposed to incredible rates of risks of destitution, that they are disadvantaged, not just within their regions, but in relation to other regions. There's a sense that actually when you frame UBI as being a response to the age-old problem of giving stuff to other people, this is something for you. You see yourself as hardworking, aspirational, as somebody who contributes to society. Well, you've got social security now. It's not something about other people who are inactive or lazy. This is about something for you, to secure you. You get 70 to 80% rates of improvement. Very high rates, historically high rates of improvement for social security systems. And the full report, which is still embargoed but will be out soon with Compass, suggests that there is a body of evidence that people in our regions in the north, the northeast, parts of Wales, see this as being an extremely impactful transformative policy. And by introducing a range of different methods, quantitative, qualitative, working with opponents of UBI within these constituencies, you get the support levels even higher. You're able to persuade people who hate the policy by working with them to increase their support for the policy by an order from a baseline of 14 out of 100 levels of support to 50. People are there to be persuaded. People just aren't persuading them. And that is a political tragedy. And these sorts of events are really important in terms of persuading those in authority that there is value to doing this. My conclusion to this is really that there is no pathway back to power for Labour unless they adopt these sorts of policies. You might get a hung parliament by low voter turnout, but on the current path, there's good evidence that they may even lose some more seats. That's a depressing finding in lots of different ways, but it ought to be a wake-up call. And it's very good that we've got this afternoon Andy Byrne, who's an opponent of UBI, coming to talk on this very topic. And one of the things that I want to finish on in terms of turning the nice idea but unelectable position on its head, I want to turn it on its head. Like, pointing this back to 1945, Natalie Bennett talked about the Beveridge Report. This is the sort of stuff that Labour used to do. Labour used to present a different material plan for people's well-being. They had a different material set of policies that were transformative. lots of people, lots of progressive politicians, basically don't think that the world needs to change much. And the policies that they've adopted are actually really quite conservative in terms of dealing with the problems that we need to deal with. The general public are way ahead of the politicians in this respect. They recognise that they need this sort of planet. Total war on bad housing, unemployment, poverty, ignorance, and inequality. They're still problems today, and if you present a programme of policy, a programme of action to people in our communities in the north of England, actually, there's a level of support there for it. It's just not being presented. So in terms of recommendations, do what the Welsh Government have done. Commit to trial UBI. There's a reason why the Welsh Government is still in power and still increasing support in lots of different respects. It has a dynamic, transformative, material-based plan of action that is transforming people's lives in Wales. It's protecting people's lives in Wales. There has to be a focus not on values, not on pretending that people are the same, if politicians are the same as people in Hartlepool. There needs to be a commitment to a material plan of action, a different economic plan that advances people's interests. That's the way back to power. And when people do adopt trials, as in Wales, they need to be evaluated comprehensively and consistently. And there needs to be good narrative framing around that, because where there have been trials in the past, there's been ambiguity about the kind of findings that have been produced. So one of the great things about the Finnish trial was that it demonstrated there was no decrease in labour market participation. Fantastic. The complaint is UBI lead people to drop out of jobs. No evidence of that. But bad framing meant that the right in Finland, well, also it didn't increase labour market participation, so why would we do it? That's a problem of framing, and it's a problem of evaluation. And we should do more micro-simulation. This work is reliable, it works with cutting-edge micro-simulation work that's being done in universities and beyond. We need something like the IFS for health, public health, health economics. You do that effectively, you've got the ability to transform a lot of the evidence-based discussions in politics. And one of the things that's become clear, and which I think some of the speakers are going to refer to later on, is that there needs to be genuine co-production, co-design with stakeholders, with members of our community. Members of our community understand the problems that face them much better than politicians do. And that's one of the issues with Brexit. People understood that there were various different problems with their communities, that communities were declining. And for various different reasons, there wasn't a tangible Remain response to that, other than you're just going to get worse. Things are going to get worse. There wasn't a response that would make things better in lots of different ways. That's one of the reasons why Remain lost. And one of the final issues which speaks to a whole range of different economic problems is that a lot of this work is being conducted in communities which are not ripe with resources. We need to make a big play for open access in research. We need to be able to evaluate things effectively, cheaply, and advance the evidence base in an effective manner. So there's the findings. I think they are in lots of different ways transformative, and I'm extremely grateful for the opportunity to launch that report.
Brilliant, thank you. We're going to move to you're actually sticking around because we're about to move to a panel discussion. And so to join Matthew, can I invite Alison, Hawdale from the UBI Lab Manchester, and Anthony Rafferty from the Work and Equalities Institute and the University of Manchester. And we have Lena Swedlow. Yeah, hi Lena. Lena is very graciously stepping in for her colleague here today. Can you join me in welcoming them? Wow, so we've had a lot to think about already. There's been so much covered. And this panel is entitled How Can Basic Income Be Implemented? So what I'm going to do is I'm going to invite each of the panelists to just take a couple of minutes to give a short statement introducing themselves and kind of their work and position. So can I ask Anthony to start that? Is that all right? If you just give a quick introduction of yourself and your thoughts on it.
Yeah, great. Thank you very much, and thank you for the opportunity to speak on this today. So, my name's Anthony Rafferty. I'm the Managing Director of the Work and Equalities Institute at the University of Manchester, and I'm also a member of the Productivity Institute there. So a lot of the work we do in the WUI is around kind of labour market inequalities, and issues surrounding the future of work, regulation, representation, and also kind of fair treatment and well-being in the workplace. So I'm here today to talk about a little bit, just to say, to advertise a report we've just done, which is on the case for a pilot of universal basic income in Greater Manchester. Now, although the report focuses on Greater Manchester, I mean, a lot of the things we discuss in there are probably transferable to other places as well and raise the issues. What we try to do in this report is first look at the case for a basic income pilot in Greater Manchester, looking at some existing proposals. So one thing that's striking and something to be discussed is that what people actually mean by a basic income varies considerably. And there seems to be a lack of agreement about what such a policy should actually look like at the moment. That's good why we have events like this to kind of be able to flesh some of those issues out. And then we looked at some of the kind of feasibility issues about how you implement that and some of the international evidence. Now, the report actually started off in the pandemic, and we were asked to kind of look at it in relation to Manchester. And I guess that kind of broader context, though, we're still living in a time of unprecedented economic uncertainty. And I think the economic insecurity argument is the big thing that's come through some of the discussions this morning. We've had the insecurity of the pandemic, we've had the insecurity of the kind of Ukraine crisis, and also global supply chain disruptions that are continuing and so forth as well. The pandemic's an interesting example because more people came to interact with the welfare system. So the idea of universality going forwards, if we do go through periods of economic crisis, you see more people interacting with welfare. So in terms of coverage, universality has some kind of arguments in that type of respect as well. But there are other challenges around kind of precarity in the labour market, platform working, the future of work. You might see more people increasingly again engaging with welfare at different points of their life. So that was the main kind of points we came from in terms of the report, and basically the inadequacy of current welfare system is one thing that comes out of it. And some of those issues about the future of work, looking beyond the current crisis in terms of the need for lifelong learning, retraining, but also supporting care in society more fully as well. The current system's not elastic enough. So if there is an economic shock, or if there's a shock in people's lives, it doesn't adjust quickly enough to those circumstances. If you've got to go back to the benefit office and restate things, or you've got a 5-week payment delay, it's that levels of disruption in income, which I think are important to consider on what basic income could, or some form of non-conditional guaranteed payment at least, could address in this respect. And I think it's important that it's about people outside and within paid work. I think as Matthew was saying, as well, and others have said, in terms of that universality. Many of the points have been made, I would make, so I'll kind of cut my talk short. I think there's another issue that we thought about in the report, which was to do with the nature of economic stimulus in crises. Now, we're talking about long-term benefit reform, and that was part of the debate in COVID, but other people also tried to discuss, could some form of direct household payments form a part of a kind of emergency responses as well? Now, one thing I think is missing in some of the debate at the moment around, for example, after the 2008 crisis, is about the inequality impacts of economic stimulus such as quantitative easing. There's little bits of evidence floating around. And this is one of the arguments we put why Manchester should, or the northern cities should support, and northern regions should support a basic income pilot. Is one argument you could make is that quantitative easing through supply of cheap money favours more capital-rich areas for investment than capital poor areas. So it has an spatial inequality effect. And it also, you could argue, we need to look at whether there's evidence to suggest that it favours richer households. So if you've got cheap mortgage rates, you're buying more buy-to-let houses. So it might kind of also perpetuate wealth inequalities. So the question is, if we're living in a period of increased economic insecurity, having a basic income system as a platform could allow in crises to create stimulus by temporary uplifts to drive demand, which goes into the pockets of households locally. And you could also think about the jobs that's created by kind of quantitative easing going through the financial system might also favour the southeast as well. So that's just one thing I wanted to add on that. So the report, there's a QR code, I won't go through the details of it, it's quite a long report, I apologise, is in the back that you've received. But just to finish off with, I think the issue of mental health that Matthew raised is extremely important. There is the effects of economic insecurity on mental health. But there is also the stigma attached to welfare and stigma attached to poverty. Yeah? And it's that experience of interaction with the state through the welfare system that's a problem as well. So I think kind of Lord Bennett's remarks about the idea of basic income being a right is one way of kind of trying to relieve that stigma, that it's a right rather than something that you're kind of having to grasp to attain. And I think it's that kind of stigma issues that, not just the income issue, that kind of relates to these mental health issues, but also issues of disengagement politically, that people see the institutions they interact with, like the welfare system, as agents of the state and representatives of the state. And if that state is punitive and they feel there's too much sanction and control in that state, then that will also affect their kind of political engagement as well. So I think some of those broader arguments and not just the economic arguments are important. But I'll stop there. Thank you. Yeah.
Super, thank you very much. And Alison, can I ask you to introduce yourself?
Yeah, do I need to move the mic? Hello, I'm Alison Hawdale and I'm one of the core members of UBI Lab Manchester. We're a small but determined group of people who are very committed to the idea of UBI and how it might impact us locally. But as Anthony said, it's about going out into, I mean, we've got Paul here from World Basic Income. You know, we can think about going out into the rest of the country and the whole world at some point with this idea. I just want to give you a bit of background about how I came across it. I first read Rutger Bregman's book, Utopia for Realists, which some of you might have read, and thought, I didn't just think it's a nice idea, I thought, this is an amazing idea, but it sounded to me like it was from the sort of wilder shores of policy, that nobody ever be seriously thinking about this, would they? And then I joined the Green Party, partly because it had UBI on its books as something it was committed to. And I went to the Scarborough conference in 2019, and there were these people called UBI Lab Network. And they were talking really seriously about a pilot in Sheffield and how this could be done. And thinking back now, it's hard for me to remember how thrilled I was with this. Oh, this is incredible, absolutely incredible. So I went back to Manchester thinking, right, okay, you know, I need to get involved in this. So I'm part of the UBI Lab Network now, and there are, I think it's about 40 labs geographically, not just in this country, but in Iceland and Jakarta, other places. There are also themed labs like youth, food, arts, that sort of thing. Dave here is part of the UBI Lab Food. And one of the reasons I got involved, and it sort of goes back to quite a lot of what Natalie was saying, was about green issues. But what I felt it was really, really, really valuable for was the just transition to a Green New Deal. If we were going to go to a really, if we're going to change society in a really radical way, so that we really embrace this idea of green jobs, we were going to have some kind of transition, a just transition where people were going to have to retrain. Well, what were they going to live on while they're retrained? So in the Green Party manifesto of 2019, one of the backbones, one of the absolute spines of the manifesto is a Green New Deal for incomes. Okay, so that's one of the policies that has been really fleshed out. And by the following conference, I think it was in Newport, we had Caroline Lucas and Natalie Bennett and Guy Standing, who's one of the sort of godfathers of UBI, talking to us about a fully costed Green Party proposal for UBI. And so that's my background in it, and I have to say I'm not an expert. Beth says she's not an expert. I'm not an expert either. I'm a maths teacher. That's how I earn my money. And so I'm a volunteer, and I would encourage anybody here who'd like to get involved in the network to come and join us, because it can seem quite difficult and it can seem quite technical, but there's plenty to be doing. There's plenty of outreach to be done to people. We're going to hear Matthew talks about the red wall voters. I'm not quite sure what you're going to say, Linda, but I know that Cleo was going to talk to us about basic income conversation. Yeah. So there's a lot to be done in going out and talking to people about UBI. Thank you.
Thank you. Okay. And Lena, can I invite you to introduce yourself?
Of course. Yeah, sorry Cleo couldn't be here. She's still on the trains and trying to get here. But yeah, I'm Lena. I'm from the Basic Income Conversation. And as you might guess from the name of the organisation, a big part of what we do is try to help facilitate as broad and wide a range of people having meaningful conversations about basic income as possible. And the reason that we do that, and the reason we think that that's a crucial step to the implementation of a basic income, is because by definition a basic income would go to everybody. And so we believe everybody should be involved in making it a reality as much as possible. We know that there are lots of talented academics and economists working on the issue of how the policy can be implemented and the impact of it. But there's also another side of the movement for basic income, and that's the human narratives and the stories. And we've always felt that our role as an organisation and as advocates for basic income was to make sure that people's experiences were considered as important data and were the most compelling reason for basic income. And as well as all that value that adds to movement as advocates and as a tool to advocate for the policy. As people interested in this idea and working on it, I think it's very easy to slip into the idea that it's a one-stop shop fix for everything. And what centering people's stories in this movement does very well is recognise the nuances of implementing this and reminds us that this is a universal solution for individualised problems. And we talk to hundreds of people about basic income every year, and the overwhelming feeling that we hear is what basic income would mean to people is a sense of relief, is a weight off their shoulders, is just a time to take a breath and make choices about what they want to spend their time doing, whether that's family or caring responsibilities or work. Whether or not we use pilots or we take leadership from the devolved governments, as we've seen in the past few years with basic income, regardless of the route that takes, we've always advocated for the idea that we need a wide breadth of stories that illustrate the need for basic income and what that basic income actually needs to look like to solve the immediate problems people face. In practice, that comes from what we call deep community engagement and consultation, which is conversation, essentially. And a lot of that happens with community organisations, anti-poverty organisations that are already on the ground, faith leaders, counsellors, people that are already in these areas that are very well equipped to tell us what we need and what a basic income can do. Basic Income Conversation has already started working on those projects. We have a few, but they have a very long way to go. I think that that is a crucial part in the implementation of basic income as we go forward. We hope to see more of those projects happening all over the country.
Fantastic. Because we've met Matthew just previously, what I'll do, if it's okay, is go to questions. I've got some questions, but I'm thinking about million things now after today. But I would like to invite questions from the floor. Has anybody got any particular questions? Can I ask you first to say your name and then ask the question? Can I?
Hello, I'm Rafferty from the University of Manchester, as from the work in Equalities Institute. I have a question for Matthew Johnson, and that was in relation to the discussion of micro-simulations. And I was wondering, what did you mean by this, and how would you kind of look and investigate it and implement it?
So that, I mean, it's, yeah, so I'm not a model, right? I'm not a model or a model. But what we've done really is to integrate a range of different micro-simulation models. So there's a micro-simulation model, which is the land tax transfer micro-simulation model, which is used by a range of different organisations. And that simulates the economic distributional impact of various different tax welfare schemes on a representative sample of society. So you use a relatively small data set, and then you just project that out onto the entire population. We did the economic modelling through land, and that was quite effective in terms of demonstrating the distributional impact. And then we looked at understanding society, which is the UK household longitudinal study, and that's really an important study because it draws on lived experience over 10 years, and you can track people's perception of the risk of destitution alongside their income changes. And what we did was to examine the changes not just between individuals across that period of time, but within individuals. So we were able to control for the changes of income and the impact on health. And we were able to demonstrate that actually the relatively high degree of confidence that the primary driver in the relationship between income and mental health is income to mental health. And then what we did was then work with another team of models at the University of Liverpool, Flaherty and Demos, to use the risk factors that we derive from the understanding society data to look at the impact on clinical cases, clinical threshold cases.
Thank you. I'm going to ask. Sorry, I've got a little queue of people. So if I'm going to ask lady in the striped shirt next, please.
My name's Laura Moynihan. I'm from Sheffield, and I'm here because I'm a policy officer for the Central Constituency Labour Party. I'm really a passionate supporter of UBI. I'd just like you to explain the difference there is between many economists. So Anna Coote, New Economics Foundation, supports, is critical of UBI, it supports universal basic services. Can you tell me which system is better, or could they coexist?
I feel like I've been dropped on. It's a really tricky question. Yeah. I mean,
I need the arguments to justify UBS. UBI, sorry.
Yeah. So universal basic services. Okay. The question of whether you can have both or not is probably a question of resources. So I mean, I think at the present time, a lot of the issues of services are the things that are stopping people from progressing in work. I mean, we think about things like childcare support. We have some of the most expensive childcare in developed nations, and that's a huge impact. So I guess it's how you fund people to have more childcare, whether a more universal childcare system will be a foundation. And I think not to fudge the question, but I think this is why we need more pilots and we need more evaluation evaluation research to see how it affects people's behaviours and how it affects kind of things like labour market participation and so forth. But at the same time, I think the kind of that argument is quite key as well about the services, because universal basic income isn't a panacea, even if it was to be implemented. That was going to be in the detail what the policy would look like, what it would replace, what it would add. But at the same time, you probably would need other services around there. It's no point people having more money in the pocket if there's no good quality childcare. So I don't think it could be an either or in that respect. So that would kind of a slight fudge of the question, but I think also, other policies such as minimum wage policies, real living wage policies are important. I mean, people have talked about kind of the potential behaviours of employers, how to stop a race to the bottom. You need floors in employment rights, and you need floors in services, and universal basic income on its own is not going to solve all the problems, I think.
Could I just add to that? So I think that's absolutely the right position. These are complementary positions. We have a universal health service, thank God, right? Yeah. One that's declining in lots of different ways, but it's declining not just because it's underfunded, but because it's dealing with the long-term consequences of radical inequality in society. And one of the things that UBI does is to reduce the demand on services. So one of the things that I would far prefer to do is to pay my parents who are geriatric and long-term unemployed to look after my kids. I'd far prefer that to paying somebody else to do it. But we don't have a system that enables us to do that. And one of the things about UBI is that it enables for a distribution of various different care and other responsibilities through the paid system. So you don't just reduce the demand on services and better target those services in certain respects. You also complement those services by enabling people to take better advantage of them when they need them.
Can I say something very quickly? I think, as Anthony said, it's not a zero-sum game. You can have a complementary version of each. What I would also add is there are some things that only income can do. We have a universal education system, right? That doesn't mean that everybody gets free school lunch. Those are two different policies that operate in two different ways to do two different things. I think we see income as the same sort of. It fills a different need to a lot of different services. I think you talked about the decrease in the strain on services. You have, I think debt prevention is often a mental health healthcare policy. And I think there's some things that really only income can do, no matter what you're looking at in society. So,
Thank you. Super. I'm going to take first from this striped shirt, I'm going to do this question, and then I'll move over to you.
Yeah.
Introducing me.
Sam Luthier would be very good at answering the question about amicus.
No, let me check in a second. Oh, no, we'll talk about it.
Yeah. One thing I would say about it is that she's quite disingenuous in that she's funded by a union that was anti-UBI, surprisingly anti-UBI. Scientists. Yeah, the question, there's a lot of talk about trials. We've got trials for decades. There's a lot of UBI advocates, myself included, who think, why have more trials? There's no reason why we can't just go to a national policy and tweak it. I personally, I think that children should get UBI as well, at the same rate as adults, by the way. And I think that would do a lot for women, because ordinarily they pay to women. And I also think, why are we relying on the government for it? We're all talking about taxes and tweaking tax system and all the rest of it, and it's something akin to welfare reform. I really don't believe that we need to do that. I think that, Natalie Bennett was quite right, there's comments that should be on to us. And I think those funds can be charged, proceeds put into a people's fund, and the dividends from that paid out to basic income. You don't need the government for that. And I'm not talking That's how we ask them to get their yearly, they don't like COVID, basically, yearly dividend. All right, so trials, and why are we talking all the time about government? Because you put down Labour Party should do this Labour Party isn't even allowing people. It's disgraceful, don't they? Labour Party, this person, anywhere near it.
Super, so we've got 2 questions in there, I think. It's why more trials? And do we need the government for this? Why do we need the government? If we do, is there any other way? Who would like to speak on that?
I'll talk about trials because we're asking Andy Burnham to support a trial in Manchester, Greater Manchester. We're looking at the work that Anthony's units have done on the sort of feasibility of doing a trial, or we don't, is it a pilot, is it an experiment, is it a trial, whatever it is. And we've had a lot of discussions, put it like that, we've had a lot of discussions, what would be the point of this? Because I agree with you, Paul, I think we should just do it. But unfortunately, that's not going to cut it, is it? So one of the reasons for doing it is publicity and discussion. And if you think about what's going on in Wales, the fact that Wales have done their pilot has created a huge stir, a huge amount of interest. And the thing that really excites me about that is that they passed a motion in the Senate on the 14th of July to say they're going to look at extending it to heavy industry. And therefore, this idea of a just transition, this idea of, we can't do what Thatcher did to the coal mining industry. If we're going to go away from fossil fuels, we have to be, taking people through that transition and helping them train. It keeps it alive. It keeps the story going. It does add to the, the information. And if you can persuade, like the Welsh government were persuaded, then they, they'll be taking this forward, hopefully. But I agree with you that I don't know the answer to your second question, so perhaps we should look at that about what other alternative ways of funding this are there, because I'd love to see that.
I'm just going to be provocative and say I completely disagree with you, but that's what we're here for, the discussion. I think it's a really good point. Why don't we just get on with doing it? Well, firstly, there's not been a real trial in the UK like done. That's an issue there, I think raising public understanding is important. I think there's a whole debate that needs to be had about what such a policy would look like, and there doesn't seem to be any consensus about that. So there needs to be some kind of consensus building around that kind of that policy as well there. But there's a more practical issue as well, is that we live in a kind of means-tested welfare system. So if we were to just give additional payments to people, the government would just claw that back through the means testing of the benefits, and they might not see any improvements there. So I know, like the Rochdale pioneers tried to look at a trial in Rochdale, and that's one of the things that came from the residents there. They were saying, well, if I take part in this, how's that going to affect my prescriptions and other kind of things that are means tested? So there needs to be some level of government coordination on it in that respect as well. But just as full disclosure, I'm part of the Manchester UBI Labs network. I think what we really need is a national initiative of local, fairly small level trials that ideally have a systematic methodology and framework that can be pooled and raise locally with local government the issues, but also then push the issues at a national level as well. So I think it's about building a movement. I'm going to say I'm agnostic on the UBI, just for the sake of it, because I think, and many people feel like that. And maybe more people could understand the policy and see how it's working. We could have a more broader discussion and more evidence-based discussion about the policy. So, yeah, I take the point, but I think it's important to kind of try these things out as well.
Anyone else want to speak on that?
Just on the state stuff, both of the examples you point to, the Norwegian pension system and the Alaska dividend are administered by the state. They're both state policies. So there is not. I mean, one of the really insidious claims that the coalition government introduced was that you're able to manage society independently of any kind of state intervention. That was used as a means of advancing austerity. And the suggestion of big society was that people without any money would be able to administer their own resources effectively. That's a nonsense. What you need is entitlement. And one of the good things about Labour historically, when it's been successful, is that it's understood that the state needs to take on the responsibility of upholding entitlements. So this is a means of upholding entitlements, and UBI is a key entitlement for us in the next few years, I think.
Can I just add one point as well about the payments to children? I completely agree with you on that one. I think payments should be made to children as well as adults, otherwise it's not universal, and pensioners as well. So I think that's a really good point when we're thinking about universality of coverage.
Super, thank you. Okay, I'm going to take one more question, but it does need to be short, so thank you for being so patient. What's your question, please?
Hi, I'm Matthew Johnson. I'm the Green Party councillor, on Manchester City Council. When I got elected in May, one of my first questions was to council, are you thinking about UBI trial? Because I think that would be really good. They said no, because they want to make sure that there is a living wage, and it's a Labour council. But that doesn't work. So my question is, what working in the different areas you are, and what do you feel are the main vested interests of that not going ahead, and how do you counter them?
Who would like to take it? You're going to have to keep it short, great. Can you take it? So the question is, what do you say to people who are saying, no, we don't want universal-based income, we want things like living wage and maybe employer-driven change to address these inequalities?
Was the question what we don't want a trial, I think, was
Okay.
yeah.
Well, in Manchester City Council said that they weren't planning a trial.
Yeah.
But what do you have to fight? What is your fight?
I guess, I don't know if people had other discussions, but understanding the reasons why they don't want to try on the feasibility issues is something here. I mean, one thing we really need to discuss is even for a trial how it would be funded without kind of core central government support and with limited powers in devolution for the local authorities to actually fund such an initiative. We need to probably move more creative about, I mean, one of the speakers from the audience was talking about kind of how we do it without government in some ways. But I think that's that kind of, in some examples there are advantages and disadvantages. Some examples in kind of like the US where they've used kind of more crowdsourcing or benefactor funding or finding other ways of funding it. I think, putting forward a clear financial model and a clear proposal, it would be key to then try to kind of managing the resistance to it. And that's the thing we need to kind of build and kind of put forwards, I guess.
Thank you. Brilliant. Quickly, really quick.
I think it goes back to Lena's point about zero-sum gain, and I think we have to get out of these silos of I'm UBS and I'm UBI and I'm living wage and I'm this 4-day week and all that kind of thing. I mean, these are all really valuable parts of the discussion about how we can improve society, so we don't have to just sort of entrench ourselves in one.
Super.